Hello, everybody. It's Phil Jacobus. It's October 29th. I'm at my home in Woodstock, New York. It's raining here. It's dark and sort of dreary outside, and tonight it's going to snow. So the summer is officially over here. Today we're going to be joined by an interesting fellow, Adam Johnson with QuoteWizard. He'll tell us about some less than a little bit gloomy news that we have on the horizon. But before we are joined by Mr. Johnson, let's take a look at some interesting stories that have occurred in our news today. One very interesting story, I think you'll agree is noteworthy, is that and Intermountain Healthcare and Sanford Health are going to merge. That's a big deal. Those are two big groups, and it will change the landscape in their geographical area. Another interesting story is talks about how CT scan volumes have fallen uh, way below expectations and where and why, obviously because of the pandemic. So I encourage you to sign up for our online news. It's free. I know that you'll benefit from it, and it only takes a minute or two. You can also pick the categories you're interested in and only receive news in those categories if that's your pleasure. Okay, everyone. So we're now joined by Adam Johnson. Adam, thank you very much for joining us.
Yeah, thanks for having me on.
And Adam is a senior research analyst for QuoteWizard, and QuoteWizard is an interesting company. Adam, in a few words, tell us about QuoteWizard.
Yeah, QuoteWizard is an insurance comparison service where we help folks shop for all sorts of insurance products. That includes auto, home, health, life, and renter's insurance.
Right. How and it must be hard to cover all of those topics, all of those um, market segments. Uh, how do you do that? How do you possibly stay on top of all those different categories?
Yeah, we try to spread the wealth as far as our analysis goes on the different economic factors that affect all of our insurance products between auto, home, and health. But in the last few months during the pandemic, we've had a laser focus on the healthcare industry and how it affects health insurance during the pandemic.
So, what have your studies suggested?
Well, one thing we've looked at is how unemployment rates, when millions of people have lost jobs early on in the pandemic, that also involved people losing employer sponsored health insurance. So it's estimated that from February to May, there was 5.4 million people in America that were uninsured as a result of job losses. So as uninsured rates occur, we do see millions of costs occurring for uninsured healthcare, especially those receiving treatment and testing for COVID-19.
Right. Now, so the hospitals are still required to treat people in the emergency room, even if they're not insured. Is that correct?
That is correct. Part of the couple economic stimulus bills that were passed, CARES Act allocated funds for treatment and testing of COVID-19 for those that are uninsured.
And was that was the money allocated able to keep up with the demand, or was there still and this has nothing to do with elective surgeries or non-COVID related problems. Is that correct?
Correct. Yeah. So this was specifically allocated for testing and treatment. So far, there has been enough allocation from the stimulus packages to cover these uninsured treatment and testing of COVID 19. As of our last analysis, which was mid-October, there was 1.5 billion spent on reimbursement of claims for testing and treatment of folks with COVID-19. The stimulus package is allocated somewhere between 175 billion to cover uninsured testing and treatment. So still plenty enough economic stimulus to cover those. But where we do see hospitals are taking a serious hit as far as their revenue streams go. Healthcare spending from April dropped in hospitals about 43% due to elective surgeries and regular visits and treatments. People just not going to those and opting to stay at home and forego treatment.
Do you think more people stayed home because they were afraid of COVID or because they were underinsured or not
Certainly,
insured?
yeah, certainly could be a combination of both, with those high uninsured rates occurring with job loss. But a lot of elective surgeries, hospitals even forewent those, and consumers as well forewent regular checkups as well as elective surgeries. So, the American Hospital Association projects healthcare systems. Losses of 120 billion from July through December of this year. And again, those are projections of revenue that hospitals would have regularly projected, but due to those regular and elective surgeries, we're seeing billions of dollars in losses.
Now, QuoteWizard did some work for AHA, is that correct?
We reference their data quite a bit. We haven't worked with them specifically, but they do provide, some of the frontline data when we look at how hospitals, especially the economic side of hospitals, are doing during the coronavirus.
Okay, so do you have any predictions for the future? And do we have any choice in what happens in the future? Those are two questions. Do you have predictions about the future? And if your predictions are either positive or negative, is there anything that could happen that would change either a positive or negative outcome?
Well, there's kind of a chain reaction that we see, and it starts with unemployment rates. Again, when people are becoming unemployed, they're losing employer sponsored healthcare. And when people become uninsured and do receive healthcare, regardless if it's COVID-19 related, when people do receive healthcare and it's uninsured, hospitals do assume that debt burden. So that puts hospitals into debt. And when hospitals go into debt, they charge more for their healthcare services. And it's those insurance companies as well as government that then assumes those high costs of healthcare. So when we talk about healthcare costs around the country rising year over year, we could likely see in the near future, in the coming years, because of the high rate of uninsured, the increased debts on hospitals, which then in turn increases the cost of healthcare. We could see a significant spike in the cost of healthcare in the coming years because of the pandemic.
Well, um, is this regional or by state? Does it change depending upon where you are in any way?
It is it is a macro economic issue around the country as far as how uninsured affects eventually the cost of healthcare. When it does come to hospitals, though, in the early part of the year, especially rural hospitals, when rural hospitals, which already have very thin margins to operate, when they assume large amounts of debts, as hospitals have been occurring across the country, especially in those rural areas, that we're seeing a number of hospital closures. And with rural hospitals closing and people in rural areas needing healthcare, those costs increase exponentially when they need to be transported to uh, larger hospitals, which could be miles away.
And what impact will hospital mergers, as we see, like today or yesterday, Intermountain and Sanford Health merged? Will that change anything?
It's uncertain how hospital mergers will play out in the near future. It is the hopes that maybe mergers allow more financial stability and allow hospitals to operate on larger margins, essentially allowing them to operate without closures or without assuming large amounts of debts, which would in turn affect would cause an increase in what they are charging for their healthcare.
So, Adam, what's your background? Are you an economist? What did you study?
I'm a data analyst, so I have a data background that
Right.
has looked at a number of economic studies, but yeah, a statistics and data background.
Okay, so uh, Any recommendations for the future? If you became president, what would you do?
Well, certainly some level of, I would hesitate to say universal healthcare, but some healthcare protections for the millions of uninsured people in the country. If we were able to provide healthcare for nearly everybody in the country, again, that would allow hospitals would not take on as much debt for treating uninsured people, which would keep healthcare costs from increasing at the rate that they are right now. So, we see healthcare costs on such a steep rise. I think really at the core is uninsured healthcare, people not having health insurance and still receiving care. So, if we could insure as many people as possible, that would keep hospitals from incurring debt, which in turn would keep our healthcare costs at a pace at a rising rate that is sustainable versus the sharp increases we've seen over the last decade and are likely to see in coming years.
Well, I can't imagine that there's anyone out there that would disagree with you that it would be a good thing if everyone had health care. Uh, and you've presented a very logical and rational analysis of why it's good financially. So this has been a great interview, and I really appreciate you spending time with us. And I hope that if you uncover more data that you think is interesting, that you'll share it with us in the future.
Absolutely, Philip. Our focus has been again on the healthcare industry and how the pandemic has shaped it in over the last few months, and then what could happen in the coming years. So we'll certainly keep you in touch with any future studies we have.
Well, thank you very much. It's a pleasure to be with you today, and I look forward to hearing from you in the future.